My name is Kaylee Jorgensen. I'm here with Becca, Colby, and Lavanya, and we are going to talk about cerebellar stroke today. So the significance of cerebellar stroke is pretty large. Cerebellar stroke is rare and accounts for less than 10% of all strokes. This type of stroke leads to poor outcome and is misdiagnosed often. Cerebellar strokes that are initially missed have a mortality rate of 40%, and half of the patients who survive have long-term deficits. Patients who experience acute cerebellar strokes have a higher likelihood of a poor recovery outcome and higher likelihood of mortality, which is quite unfortunate. And a lot of this is due to because of misdiagnoses. It just looks a lot like other types of strokes, and it's hard to find. And the mortality rate is largely dependent on different factors as well. So the type of cerebellar stroke, the severity of the stroke, and the quickness of treatment. So the quicker you treat cerebellar stroke, then the greater positive outcomes there are, which is hard to do when it's getting misdiagnosed. So moving on to the description of the diagnosis, cerebellar stroke has fatal effects on the brain due to an inaccessibility of oxygen. When the bloodstream is unable to carry oxygen to the cerebellum, the brain is receiving inadequate amounts of oxygen to function. So this causes a disruption and puts the individual at a risk for hypoxia or an insufficient oxygenation, which can cause brain cell death within a few minutes. If the stroke is not treated immediately, fatality becomes a higher risk factor, which is what I said in the previous slide. And there's two types of cerebellar strokes. So like I said before, your greater outcome really depends on whether or not it's ischemic or hemorrhagic. So an ischemic stroke is caused by a blood clot in the blood vessel that supplies the cerebellum, and then the hemorrhagic stroke is caused by a bleed from a rupture of trauma to a blood vessel that supplies the cerebellum.
The cerebellum is supplied by the vertebrobasilar system, and that's made up with the superior cerebellar artery, or SCA, the anterior inferior cerebellar artery, or AICA, and the posterior inferior cerebellar artery, PICA. So a blood clot or rupture of any of these arteries could lead to a cerebellar stroke.
So the effects on ADLs from a cerebellar stroke. This could cause limb and gait ataxia and can decrease executive functioning. So this can hinder balance and proprioception, decreases coordination, can impact toileting and bathing, and decreases limb control, and can make feeding difficult. So with all of these, balance and coordination is very key, and it makes all of these activities of daily living very difficult. And you also have postural instability, nystagmus, and vertigo, which can cause dizziness and can make dressing difficult, decrease visual and depth perception, which can also put someone at a greater false risk.
So for cerebellar strokes, it's important for rehabilitation to begin as soon as possible after the patient has suffered from the stroke. And then recovery can continue on for months after the stroke had occurred. So for occupational therapy, it may begin while the patient is still in the ICU. And depending on the severity of the stroke and the patient's current status, therapy can range anywhere from increasing environmental engagement to beginning early mobility. So in this setting, therapists are often seen working with the patient on just maintaining strength and maintaining their range of motion while also increasing their stimulation. And then after the ICU, depending on the progress that the patient had made, they'll either be discharged into an inpatient facility or a skilled nursing home. So there you'll see OTs working to increase the muscle strength instead of just maintaining it, and then improving their balance and improving independence while completing ADLs. And then afterwards, they'll tend to be discharged to an outpatient rehab. And there, the therapist's focus tends to shift to educating both the patient and the patient's families. They also create home exercise programs and increase independence during ADLs.
One assessment occupational therapists use for patients with cerebellar strokes is the Romberg test. This tests a patient's proprioception and balance skills. So in order to perform the test, the patient stands with their feet together and their eyes closed, and if any sway is present, then that's indicative of a positive Romberg test. And the sharpened Romberg test includes other positions that the patient will stand in, such as semi-tandem and tandem. And here's our references. Thanks for listening.